My name is Lanika Ellis. I am the 340B External Audit Manager. I have over 10 years of 340B experience. 8 of those years was spent at the FQHC. I also have 13 plus years as a pharmacy technician. When considering administering 340B clinic-administered drugs, there are 3 things to consider: state and federal requirements, tracking and auditable records, and ongoing compliance. The first thing to consider would be your state and federal requirements. The next thing would be tracking. Tracking is very important because it is required to show the utilization of the 340B drug. When utilizing those 340B drugs, you should be able to track the date it was dispensed, the quantity dispensed, the drug dispensed, as well as who ordered that drug. So when considering softwares or tracking methods, these things should be kept in mind. One of the big issues we see when dispensing 340B drugs is maintaining auditable records. Your auditable records should be able to show the processes the drugs went through, from procurement to dispensation to the patient. When thinking about auditable records, your logs should show the date that the medication was dispensed, the patient that it was dispensed to, the drug, as well as the quantity. The quantities are important because you would like to tie out those with what was ordered, dispensed, and your current balance on hand. Make sure that the utilization of the drug balances with your balance on hand, looking back at what was ordered, and the ending amount for the month. It's important to maintain auditable records so that you can show the dispensation and utilization of the 340B drug. When utilizing 340B drugs, it is important that the quantity ordered and dispensed is reconciled at the end of the month. These reconciliations should be able to tie back to each order of the drug on a patient level.
My name is Michael Gonzalez. I'm the founder of the company. My background's a little bit different than the rest of my teams. I come from the accounting side of community health centers, so started my professional career performing single audits. I transitioned into 340B with the goal of supporting our community health centers and making sure we could take care of the patients in need. Clinic-administered drugs can be difficult for community health centers to manage and maintain compliance within the 340B program. They can even cause you to lose a little bit of money. One thing that we recommend or help clients work through is doing an assessment of the clinic-administered drugs that are purchased. So we do a price analysis. One way you can do that is working with your wholesaler to receive a purchase order history for the past 12 months. On that purchase order history, you want to request the 340B price that you paid for the drug and what that drug cost would have been had you bought it on a WAC or non-340B account. By cross-referencing that data to the number of units you purchased, you can then identify what the cost saving is. And so we've helped several health centers bring that list down from 150 NDCs to 20 that makes sense and provide most of the 340B benefit. But what always blows my mind is if you sort that list high to low, you'll see quite a few NDCs where you're actually losing money from rebates that you could have been getting on the retail side.
I'm Felicity Homestead. I'm the CEO of FQHC 340B Compliance. My background is I am a pharmacist. I've spent over a decade in the 340B program. I've had the opportunity to serve as a subject matter expert, originally for the 340B peer-to-peer program with the Office of Pharmacy Affairs, then as Apexis 340B University faculty, and authored a number of their operations certificate modules for their ACE program. And then more recently, I have had the pleasure of also being a co-lead investigator for the National Institute of Drug Abuse in a research study integrating pharmacists into the treatment of opioid use disorder. Another challenge with clinic-administered drugs is billing. We see a lot of difficulty in understanding, first of all, how do we designate with the Office of Pharmacy Affairs our billing processes? So each covered entity, including the federally qualified health centers, are expected to tell the Office of Pharmacy Affairs how they will be handling their 340B drugs, both within their clinics and if they have in-house pharmacies, that as well. But for the clinic side, what we often see is there's confusion in the federally qualified health center space. Because most health centers bill under what is called a PPS, or a prospective payment system, they often are not charging for medications outside of a bundle bill. This leads to the misconception that they're not billing for medications. So typically what we will see is that health centers using 340B medications choose to say no when they're answering the Medicaid carve-in question on 340B OPACE. However, what the question is asking is, are you using 340B medications when you're billing Medicaid? And so because the health centers are not billing specifically for the drugs, they're answering no, but technically they are billing Medicaid. And so the way that the Office of Pharmacy Affairs would expect them to answer is by saying yes. One common area where we see health centers have a potential non-compliance in a HRSA audit that can easily be corrected by understanding what the question is asking and having an expert guide them through the process of understanding what their operations are and how to correctly answer. The last thing you want in your 340B program is to be surprised in a HRSA audit. One thing that we have seen come up is when the leadership is not aware of all of the 340B accounts that are open within their clinics. A great way to be able to check on this is utilizing a free tool offered through the Apexis 340B Prime Vendor Program. And all you have to do is log into the 340bpvp.com website and check on your historical purchases. By running in a historical purchase account, you can see all of the orders that have been placed with your different wholesalers and different vendors for your 340B clinic accounts, and it will help you identify if there are purchases being made that you were not aware of, and can also help you track that your utilizations are consistent with the purchases that you're making within your clinic.
Hi, I'm Logan Yoho. I'm a pharmacy services consultant. I have over 13 years of pharmacy experience, over half of which is inside an FQHC as director of pharmacy. One of the most common challenges brought to us by FQHCs is managing their 340B clinic-administered drugs. An expectation of every covered entity is to track the drugs from the time they're purchased until they're dispensed to an eligible patient. Unfortunately, FQHC's EMRs, or electronic medical records, are not really up to that task. Unlike a in-house pharmacy where you have a dedicated software that tracks that drug appropriately, our electronic medical record can't keep up with it. FQHCs use a variety of methods to track meds, including using paper logs, Excel spreadsheets, or even purchasing additional software. None of this is truly ideal for the task. As you've heard from some of our team, it can be really challenging to manage your clinic-administered drugs. If you're looking for a partner to simplify that process, contact us today at fqhc340b.com.